I'm 68 years old and I've seen something that terrifies me, not as a doctor, not as the former Surgeon General of the United States, but as someone who has spent half a century studying what kills us. In 1982, I stood before Congress and told them that cigarettes would kill more Americans than any war, any plague, any disaster in our history. They laughed at me. The tobacco industry called me an alarmist. My colleagues said I was overreacting, but I was right. 40 years later, smoking has killed 20 million Americans, 20 million sons and daughters, mothers and fathers, friends and neighbors. And now, I'm here to tell you something even more urgent. In 2026, we are facing a heart disease crisis unlike anything we've seen since the 1950s, and the warning signs are already here. But your doctor isn't telling you. The media isn't covering it, and most people won't know until it's too late. I'm not here to scare you. I'm here to save you. Because what I learned in 5 decades of medicine is this: the deadliest diseases aren't the ones that strike suddenly. They're the ones we see coming and choose to ignore. Let me take you back to 1964. I was a young surgeon at Children's Hospital of Philadelphia. That year, I performed my first pediatric cardiac surgery, a 6-year-old boy with a congenital heart defect. His name was Michael. Michael survived the surgery, but 2 weeks later, his father died of a massive heart attack in our hospital parking lot. He was 41 years old. I remember standing in that parking lot looking at the outline where his body had been. The ambulance had already left. The police had taken their statements, but I couldn't move because I knew something that haunted me. His death was preventable. 3 months earlier, Michael's father had come to see me. He complained of chest tightness when he climbed stairs, shortness of breath when he played with his son, a squeezing sensation in his jaw after meals. I told him it was probably stress, maybe acid reflux. I gave him antacids and sent him home. I was wrong. Those were classic warning signs of coronary artery disease. But in 1964, we didn't talk about prevention. We waited for the heart attack, then we tried to save you. By the time Michael's father collapsed in that parking lot, 90% of his left anterior descending artery was blocked. We call it the widow maker. One of his coronary arteries was completely occluded. He never had a chance. That day changed my life. I made a promise. I would never again ignore the early warning signs. I would learn to see disease before it killed. And what I've learned over the past 60 years is this: heart disease doesn't start with a heart attack. It starts decades earlier, with signals your body is screaming at you to notice. Now let me tell you why 2026 will be different and dangerous. 3 things are converging right now that will make 2026 one of the deadliest years for cardiovascular disease in modern history. Between 2020 and 2023, millions of Americans delayed or skipped their routine medical checkups, cancer screenings, blood pressure checks, cholesterol tests, cardiac stress tests. We stayed home. We were scared. We prioritized COVID over everything else. But while we were hiding from a virus, another killer was silently growing inside us. I've reviewed the data from the CDC, the American Heart Association, and major hospital systems across the country. What I'm seeing is alarming. Hospital admissions for heart attacks dropped by 40% during the pandemic, but people didn't stop having heart disease. They just stopped going to the hospital. And now those delayed diagnoses are catching up with us. There's a 3 to 5 year lag between when cardiovascular disease begins and when it becomes symptomatic. That means the person who skipped their checkup in 2021 might have their first heart attack in 2026. The data is already showing this trend. In 2024, emergency room visits for acute myocardial infarction increased by 18% compared to pre-pandemic levels. Early reports from 2025 suggest the numbers are climbing even higher. Here's something most doctors won't tell you. Heart disease isn't just about cholesterol. For decades, we focused on LDL, bad cholesterol, as the primary culprit. We told patients to eat less fat, take statins, and watch their numbers. But we missed the bigger picture. The real driver of heart disease is chronic inflammation. Inflammation is your body's response to injury or infection. It's supposed to protect you. But when inflammation becomes chronic, when it never turns off, it damages your arteries from the inside out. And right now, Americans are more inflamed than ever. Why? Stress, poor sleep, ultra-processed foods, sedentary lifestyles, social isolation. All of these things trigger inflammatory pathways in your body. During the pandemic, all of these factors got worse. We ate more junk food, we slept less, we sat more, we felt more anxious, more isolated, more hopeless, and our arteries paid the price. I've seen studies showing that C-reactive protein levels, a marker of inflammation, have risen significantly in the American population over the past 5 years. High CRP is one of the strongest predictors of future heart attacks. Your body is on fire and your heart is burning. When I started practicing medicine, heart disease was an old person's problem. If you made it to 65 without a heart attack, you were doing well. But that's no longer true. In the past decade, heart attacks among people under 40 have increased by 2% every year. 2% might not sound like much, but compounded over 10 years, that's a 20% increase. I'm seeing 30-year-olds with coronary artery disease, 25-year-olds with hypertension, 20-year-olds with metabolic syndrome. Why? Because the risk factors that used to take 50 years to develop are now developing in 20. Obesity, type 2 diabetes, high blood pressure. These conditions used to be rare in young people, now they're epidemic. The average American child consumes 17 teaspoons of added sugar per day. 17. Their pancreas is exhausted before they finish high school. And sugar isn't just making us fat, it's making us inflamed. It's damaging our endothelium, the delicate inner lining of our blood vessels. It's accelerating atherosclerosis, the buildup of plaque in our arteries. By the time these young people reach their 40s, their cardiovascular system will be 20 years older than it should be. 2026 will be the year we see the full impact of this trend. Here's the problem. Most doctors are still practicing 20th century medicine in a 21st century epidemic. They're waiting for the obvious signs: crushing chest pain, radiating arm pain, shortness of breath. But by the time you have those symptoms, the damage is already done. The key to surviving the 2026 heart disease crisis is learning to recognize the early warning signs, the signals your body sends years before your first heart attack. Let me share 3 signs that are critically important but almost always ignored. Fatigue is the most overlooked symptom of heart disease, not the kind of tired you feel after a bad night's sleep. I'm talking about bone-deep exhaustion that doesn't improve with rest. You wake up tired. You feel sluggish all day. You need caffeine just to function. You fall asleep on the couch every evening. Most people blame stress, or age, or just getting older. But here's what's really happening. Your heart isn't pumping efficiently. Your tissues aren't getting enough oxygen. Your body is compensating by slowing down. This is called chronic fatigue, and it's one of the earliest signs of heart failure. I had a patient, let's call him Robert, who came to see me in 1995. He was 52 years old, a successful accountant, seemingly healthy. He told me he was tired all the time. He thought maybe he needed vitamins or testosterone or a vacation. I ordered a cardiac workup. His ejection fraction, the percentage of blood his heart pumps with each beat, was 35%. Normal is 55-70%. Robert's heart was failing and he didn't even know it. We started treatment immediately: beta blockers, ACE inhibitors, lifestyle changes. Robert is still alive today, 30 years later, because we caught it early, but most people don't catch it early. They ignore the fatigue until they end up in the emergency room. Gentlemen, listen carefully. Erectile dysfunction is not just a bedroom problem. It's a vascular problem. Your penis is a vascular organ. It requires healthy blood flow to function. When the small arteries in your penis become clogged with plaque, you can't maintain an erection. But here's the important part. The arteries in your penis are smaller than the arteries in your heart. That means they get clogged first. Erectile dysfunction is often the first sign that you have widespread atherosclerosis. Studies show that men with ED are 80% more likely to develop heart disease within 5 years. 80%. But most men are too embarrassed to tell their doctor, or they take Viagra and think the problem is solved. It's not solved. Viagra doesn't unclog your arteries, it just temporarily increases blood flow. Meanwhile, the same plaque that's blocking blood flow to your penis is also building up in your coronary arteries. If you're experiencing ED, don't just treat the symptom. Investigate the cause. This one surprises people. What do your gums have to do with your heart? Everything. Your mouth is a window into your cardiovascular system. Gum disease, periodontitis, is caused by chronic bacterial infection in your gums. These bacteria don't just stay in your mouth, they enter your bloodstream. Once in your blood, they trigger systemic inflammation. They activate your immune system. They damage the lining of your arteries. Multiple studies have shown that people with severe gum disease are twice as likely to have heart disease as people with healthy gums. Think about that. Your dental hygiene could be as important as your cholesterol level. I've seen patients with perfect cholesterol, normal blood pressure, healthy weight, but severe periodontal disease, and they still had heart attacks because inflammation doesn't care about your LDL number. So why isn't your doctor talking about this? 3 reasons. The average primary care appointment in America lasts 15 minutes. 15 minutes to review your history, check your vitals, address your concerns, and prescribe treatment. There's no time for prevention. There's barely time for diagnosis. Your doctor isn't neglecting you. They're overwhelmed. Our healthcare system rewards treatment, not prevention. Doctors get paid when you're sick. Hospitals make money when you need surgery. Pharmaceutical companies profit when you take medication. Nobody makes money when you're healthy. I'm not saying doctors are greedy. I'm saying the system is broken. Prevention doesn't generate generate revenue, so it gets ignored. Most doctors were trained to treat disease, not prevent it. In medical school, we learn pharmacology, pathology, surgery. We learn how to fix problems after they happen, but we don't learn how to stop problems from happening in the first place. I graduated from Cornell Medical College in 1941. I received exactly 0 hours of education on nutrition, 0 hours on lifestyle medicine, 0 hours on prevention. Things have improved since then, but not enough. Most doctors still don't know how to talk to patients about diet, exercise, stress management, or sleep. They know how to prescribe statins, but they don't know how to reverse atherosclerosis. Here's the good news. You don't need to wait for your doctor. You don't need to wait for the healthcare system to change. You can start protecting yourself today. Let me give you 5 specific actions that will dramatically reduce your risk of heart disease in 2026 and beyond. You need to know 5 numbers: blood pressure, LDL cholesterol, HDL cholesterol, fasting glucose C-reactive protein, CRP. These 5 numbers will tell you more about your cardiovascular risk than anything else. Get them checked, write them down, track them over time. And don't just accept normal. Normal isn't optimal. Optimal blood pressure is below 120/80. Optimal LDL is below 70 if you have risk factors. Optimal CRP is below 1.0. Exercise is the single most powerful intervention for heart health, not because it burns calories, not because it makes you look good, because it reduces inflammation, improves endothelial function, lowers blood pressure, and increases insulin sensitivity. You don't need to run marathons, you just need to move. 30 minutes of walking 5 days a week. That's it. Studies show this simple habit reduces your risk of heart disease by 30–40%. 30 minutes, 5 days, 40% risk reduction. Show me a drug that does that with 0 side effects. Because it does. Chronic sleep deprivation increases inflammation, raises blood pressure, impairs glucose metabolism, and accelerates atherosclerosis. People who sleep less than 6 hours per night have a 48% higher risk of heart disease than people who sleep 7 to 8 hours. 48%. Sleep isn't lazy. Sleep is medicine. I don't care if you're vegan, paleo, keto, or Mediterranean. What I care about is this. Are you eating real food? Real food comes from the ground or had a mother. It doesn't have a barcode or a list of ingredients you can't pronounce. Ultra-processed foods are killing us, not because of calories, because of inflammation. These foods are designed to be addictive. They're loaded with sugar, salt, and industrial seed oils. They hijack your brain's reward system, and they inflame your arteries. Every meal is a choice. Choose real food. Chronic stress is as dangerous as smoking. When you're stressed, your body releases cortisol and adrenaline. These hormones raise your blood pressure, increase your heart rate, and promote inflammation. Over time, this damages your cardiovascular system. You need a daily stress management practice. Meditation, prayer, yoga, deep breathing, time in nature. Find something that works for you and do it every day, not when you feel stressed. Every day. Because prevention happens in the moments when you're not yet sick. I'm 68 years old. I've performed thousands of surgeries. I've saved countless lives. I've also lost patients I should have saved. And here's what I've learned. The medicine we practice today is mostly failure management. We wait until you're sick, then we try to fix you. But the real power isn't in treatment, it's in prevention. 2026 will be a turning point. Either we wake up to the heart disease crisis coming, or we sleepwalk into a public health disaster. The choice is yours. You can wait for your doctor to warn you. You can wait for symptoms to appear. You can wait until you're in the emergency room, or you can act now. Check your numbers. Move your body. Sleep well. Eat real food. Manage your stress. These aren't complicated. They're not expensive. They don't require a prescription, but they work. I've seen it work for 60 years, and I promise you this. If you do these 5 things consistently, you will not be part of the 2026 heart disease crisis. You'll be the person who saw it coming and got out of the way. Don't wait for permission. Don't wait for motivation. Start today, because your heart is counting on you.